The only supplement that I strongly advocate for, at least our group, and I'm sure your panel also will probably agree with me, is vitamin D. And vitamin D, I think in recent years has come on the forefront that quite a bit of our patients, majority of our patients, at least in Northwest where I am based, almost 80 to 90% of people will be deficient. So it's quite prevalent in general population as well. And then there is some research heading, which is kind of focusing towards whether vitamin D deficiency can actually worsen the MS disease activity in itself or disease disability. So we are proactive about checking vitamin D. The way to manage vitamin D deficiency is a simple blood test can be done by routine PCPs, or neurologists can do it. And based upon your blood levels, then we can recommend what the supplementation might be. So I think that has to be kind of, again, individualized based upon what your levels are. Vitamin D, again, the only source of vitamin D that we can take is either through sun, by skin absorption, or by fortification of the food. So that's one thing. Or certain food which are rich in vitamin D are like fish-based diet. So those are the few things. So one has to be careful about vitamin D deficiency. And Emmanuel, if you want to say something about that as well, vitamin D.
I would just add that we are currently testing, Dr. Maury, who's based at Hopkins, has launched a trial in multiple centers in the US, trying to understand whether vitamin D supplementation slows down the progression of MS. So we're still enrolling at multiple sites. I think most of the sites here are participating.
Yeah. So then moving on to SWANK diet, I do believe strongly in like healthy eating, and everybody, all of us, like whether MS or not, we should be eating much more healthier, and in particular MS patients should be more aware of the nutritional intake. In general, low-fat diet will be healthy. There is some research looking at effect of sort of diet-related or lifestyle-related diseases and MS disability. For example, this registry called NARCOMS, they looked at thousands of patients looking at their risk factor, such as diabetes, high blood pressure, heart disease, peripheral vascular disease, and relationship to MS disability. And what they found that if a patient who had even one of these risk factors, or what we call as vascular risk factors, their risk of getting disabled was much higher than people who had none of these factors. And I think all of the panel members will probably agree that most of these vascular risk factors are related to our lifestyle and diet. So hence diet is really, really important. Dr. Swank was a neurologist, I think, who had a strong influence on the MS management in 50s through probably 80s or early 90s, when there are no medical therapies available. Having said that, I think he did influence our work to a certain extent, but I do believe we do need to take medications like conventional medication, disease-modifying therapy, in addition to making the diet changes. So in general, low-fat diet is recommended for more of a general health, and by doing more research in this field, I think we will probably understand the complex interaction between the environment and the disease itself, because I think we have a lot of unanswered questions which we need to get to. So hopefully, I think we will continue to do this research, and there is a lot of data now about, or kind of emerging data about role of gut microbes or bacteria which grow in gut, which are clearly related to the diet, and hence that connection of immunity and gut microbe and diet has to be explored much further. Then the fourth comment was about miraculous stories that we hear in news, and I think probably most of us will agree that again, one case of a miraculous I'm skeptical. I think in general, again, if you change a diet from not eating very healthy to a healthy diet, definitely, you will see improvement in your overall health. So that clearly, I think I'm fully supportive of that. And of course, if you change your exercise regimen, start implementing neurostimulation, or kind of stimulating the nervous system, I'm sure one will definitely feel improvement. So I think yes, it's an overall package that matters instead of just one pill or just one medication. But again, I want to believe in miracles, but I'm not sure one story alone is enough to be convincing all of us to. Again, I think as a scientist, we're all skeptical all the time. We judge, we question, so I think that's where we are. Then the next question was about drinks, and again, I'm not sure it's drink like alcohol or is it sugary based. So there's a lot of, again, I think sugar based drinks definitely are not healthy. I think most people agree that there's no need for us to be drinking pure sugary, which is highly prevalent. I think we, as a society, we consume so much sugar based drink, which from kids and all, and the kind of the disease which are related to diet probably are sugar-based. A majority of them are sugar and fat-based, if you just look at in general. So I think I definitely would not really recommend, sugary drinks, if that's the question. Mushrooms, I'm not sure actually. I'm not aware of the mushroom.
I think
I've not dealt
part of the magical cure, I think. The magic mushrooms.
I study like complementary, but not each and every substrate or component I understand. So I probably will skip that. I do not know much about that. And then plant-based diet is what we experimented with in our clinical trial, which we just finished this March. Again, so it's a plant-based vegan diet. It's a low-fat diet. And when I say low-fat diet, for example, if you go by the American Heart Association or American Diabetic Association guidelines, the amount of fat that one should be taking should be less than 30% of your total caloric intake. What we did with our intervention was approaching more like 15%. So it's still quite a bit of a decrease in the total fat intake. And again, there is some data that like saturated fat coming especially from the red meat or meat-based diet is not as healthy, hence one should avoid that, and that can be pro-inflammatory. And I'm sure in coming years, there's so much in fact, NIH, which is our national body for research, they are paying a lot of attention on improving the health of general population by dietary interventions. I think this will keep coming, and the media also will be highlighting these issues quite a bit.
So with such a good answer, we'll let you have whatever you want for lunch. You can have your own. I have a question for Dr. Peltier, but before, here's one for Nancy. Why is MS rarely mentioned in the press? And what can we do to increase awareness of MS?
It's a very interesting question. I think MS is being mentioned more in the press than it used to be mentioned. I think it used to be like a dirty secret, and nobody was mentioning it. I think now it's being mentioned much more, and the more everybody can do to get the word out and educate people about MS, it'll really help us in our plight to find a cure. The more people feel comfortable understanding a disease, the more likely are they to donate money to help other people that have it. I just also want to congratulate our honorees from last night. I see Sharon Osborne sitting here, and Jack. And one really great thing that Sharon has done, and I think they're going to do for the month of May, is to talk about MS. We have a campaign for the month of May called Orange You Happy to Erase MS, where we are trying to increase the awareness about MS so people will understand MS. Ultimately, the idea is that will help us raise more funds that will go into more research, but also to help people have a certain amount of dignity that live with this disease and to be understood. Some people are frightened of even shaking hands with me sometimes, thinking that they will catch MS. That's not how you get it, I promise.
Are you sure? Because I think I shook your hand once.
Yeah, you might get, if you shake Jack's hand, I don't know. No, but
Highly contagious.
there's, I think it's really important that everybody's mature and understands that you cannot catch MS by sharing whatever. And I'm so grateful to have people like Sharon Osborne, her great show called The Talk. They did a wonderful episode this week, and they really talked about it. It really helps getting the word out. So anything anybody can do, I think, will help all of us in the future.
Okay, just a moment. We have a couple of doctors that have to catch a flight. So let's do a quick lightning round of a few questions, and then some of the panelists will be sticking around to talk to you. So, Dr. Weiner?
Fine. So, Manuel, are you one of those doctors? Yeah. So you want to answer a bunch of quick questions, and Dr. Peltier, I then have something for you. So, if you have MS, can you donate blood?
Yes.
You can. Can you donate your organs for educational purposes?
Yes, you can.
Okay. What if you want to study, volunteer for studies? How do you do that?
You can volunteer for studies. They will tell you there are inclusion-exclusion criteria when you volunteer for studies, and they'll tell you whether you fit the type of people they want to get in the study.